My name is Natha Anderson, and I'm the president of the Washoe Education Association. We represent teachers, counselors, school nurses, and school librarians, as well as other educational professionals. Unfortunately, today, one of our nurses who was ready to testify had to go home for some other things. So with the chair's okay, I'd like to be able to read her information for the hearing. If that's okay?
Go ahead.
Thank you. Good afternoon, Chair Dennis and members of the Senate Education Committee. My name is Jocelyn Jackson, and I am a school nurse. I'm here today because regarding the ratios of specialized instructional support professionals. The National Association of School Nurses, or NASN, is our professional association. It is the position of NASN that daily access to a registered professional school nurse can significantly improve students' health, safety, and abilities to learn. Schools are identified as primary locations to address student health issues, and the school nurse is often the healthcare provider that a student sees on a regular basis. Appropriate school nurse staffing is related to better student attendance and academic success. However, currently, there is no school nurse ratio in the state of Nevada. Some school nurses have caseloads that exceed one school nurse to every 2,500 students, and or have up to 4 different school sites to travel to in a day. NASN recommends one school nurse to every 750 students in a healthy student population. School nurses are responsible for managing the health needs of all students on their caseloads, which may include, but are not limited to, diabetes care, tracheotomies, I'm happy I could say that, mechanical ventilators, gastric feedings, special education assessments, meetings, state-mandated health screenings, immunization compliance, medications daily as needed and emergency, training and delegation to unlicensed personnel, covering school health offices when clinical aides are absent, covering non-delegable procedures at different sites, creating, implementing, and managing emergency action plans, as well as numerous other information. Again, a ratio of one school nurse to 750 students has been widely recommended and was acknowledged, and I respect the role that you are in at this time. Thank you, Jocelyn Jackson, registered nurse, school nurse as well. Thank you so much for allowing me to do that.
Thank you. Go ahead.